Okay, today we're going to talk about indirect care behaviors. So when we talk about direct care, we're talking about the actual physical care of the patient. When we talk about indirect care, it's more communication and emotions, okay, and how in body language. So there are some basic standards. Some of the standards, especially, is you want to knock when you enter the room. And then patients' rights. You want to respect patients' rights. When it comes to the skills test, the evaluator will be listening to your indirect care, so your communication and your body language, how you treat the patient. And what they're going to be watching for more will be skills such as perineal care, partial bed bath, foot care, nail care, and catheter care. And feeding. Those are skills that you sit down with the patient, or you're getting into their personal space there, and you're spending intimate time with them, and doing intimate care for them. So at that time is where communication is vital. And actually, you find out things that happen throughout the night or throughout the day. You even find things out such as abuse or misappropriation, such as people taking their things, and just or they won in bingo. Okay, so, and then they're going to be looking for, so indirect care, you want to make sure when you are doing physical care that you're respecting the rights and you're communicating. Let's talk about greeting and introducing yourself. So before you come into a room or you enter a room, you want to knock. It's just like if you were walking down the street selling items and you just went into everybody's door. That would be a problem, right? What do you do first when you approach somebody's house? You knock on their door and you allow them to make the decision if they want you to come in. Now, when it comes to elder care or specific situations where people cannot speak back to you, then you can walk into the room after knocking and they can still refuse care. And what do you do if they refuse you in the room for any particular reason? You want to respect their decision. And if they refuse care, you want to respect their decision. That's first and foremost. Do you want to know why? Of course you want to know why. And if that might have to be a charge nurse's duty to find out why. But let's just say it's, hey, I don't want to take a bath right now. Then you want to ask them when is a better time to take a bath. They might want it after breakfast or after lunch or even the next day. Just find out and then always report to the charge nurse. So, again, the evaluator, when you take your state exam, will be observing how you communicate with the person or with the mannequin. Remember, you will play the role of a patient, and then there will be the person actually taking the test. Let's see. Standard precautions will be used throughout the skills. And what is standard precautions? And we'll dive a little bit more into that when we get into infection control. But think about the word standard and then the word precaution. Standard across the board, something we do all the time, and then precaution. Pre, so in the beginning, and then caution, like alert, alarm. So before the alarm goes off, what can we do as a standard to control infection? Yes, we can wash our hands. That's one of the standards. The other standard is if you will be in contact with blood or bodily fluids, then you need to wash your hands and wear gloves. And after you wear your gloves, or take off your gloves without soiling yourself or your uniform, then you need to wash your hands. Okay, and then there's some non-specific communication, like you've got communication where it's more specific to the skill, such as, let's say, range of motion. If you're going to do range of motion on someone, before you even touch them, you want to say, I'm going to do a series of exercises, let's say on your elbow, but before we get started, please let me know if you feel any pain or discomfort. Okay, that's direct communication. And then as you're doing it, then you're holding the specific areas, you want to still make sure they're okay. Uh, and those are points. There are certain points where you want to make sure someone is okay, just like you would stand them up to ambulate, meaning to walk. Well, as they stand up and they stand upright, you want to make sure that they're not dizzy or wanting to faint. We don't want to say that specifically, but we want to say, are you okay standing? And I mean, sometimes saying are you okay too many times could be kind of a little annoying to some patients. So you want to make sure it's at certain checkpoints where it's rational, okay? Because if you ask them too many times, they're going to think that maybe you're not thinking they're honest, and that can happen. But let's just say, so not specific to care, but just regular communication. Say there's a book on their over bed table, and you're about to do their care, and you say, oh, so I'm just going to remove this book. Oh, I see you're reading, The Native Son. Okay, great. I've read this before. Or you could ask them, how is it? Is it a good book? What page are you on? And as you're moving stuff over, you can continue to talk about the book. Communication about the patient is so important. It's why you are there. You are there to care for them. So I had one patient tell me, Nikki, tell your students when they come into my room to talk about me, to ask about my well-being. I don't want to hear about everybody else's problems. And she said, she was in a facility, and she said, all I hear all day is, well, my baby daddy I got into a fight, or I got here late because I had a flat tire, and all these woes, or even happy things. I went out to a club that night, and remember, this person's laying in bed, can't take care of themselves, and you think they're living vicariously through you, when actually they want to live themselves still. They're still here. So make their surrounding, their family, what they like and dislikes, make the situation about them. And even if you use pictures on the wall, cards, and remember to always look around the wall for signs that the family members have left. Don't forget, my mother's head of the bed should be 30 degrees up at all times. Don't dismiss those signs. They're signs from your directors and things like that. So let's see what else we got here. Okay, let's talk more about the communication when it comes to specific skills.